Now that we've reached the end of the COVID-19 public health emergency, the care you receive related to the virus will look a little bit different.
Yeah, that's right. 13 WRAX's Samantha Soto is with us now. And Sam, what should people know about COVID care moving forward?
Brittany and Will, the big thing health experts are stressing is the virus is far from over. That's why some local health departments are still offering vaccines and testing, but you may be wondering what this means for your health coverage. Here's what you need to know. Health experts are preparing for changes in the way we deal with COVID-19. This fall, healthcare workers are anticipating the commercialization of vaccines.
The federal government, they have purchased a supply of COVID vaccines, which are free and will continue to remain free until they run out. And that's anticipated early fall.
This will create a problem for anyone without health coverage.
People who are not insured won't be able to get vaccines like they used to.
Boone County Health's COVID response supervisor says the department will revisit how they offer vaccines at their clinics in the future. However, Chief Medical Officer for Blue Cross and Blue Shield of Illinois says it is expected that COVID vaccines will be covered under insurance carriers depending on your provider.
So I think we'll continue to see a transition with regard to some of those services that were free of charge during the public health emergency, transition to how we typically approach illnesses that we're customary to seeing.
Dr. Robinson believes COVID vaccines will become annual, similar to flu shots.
We know that both of these vaccines are highly effective in reducing the risk of severe illness and hospitalization. And so we do want individuals to make that part of their regular health maintenance routines.
He's encouraging people, especially who are at risk, to keep up with suggested vaccines.
Again, we're moving out of the PHE, but we still want to ensure that people are doing what's necessary to keep themselves safe and well. We made a lot of progress. We don't want to yield that ground that we've made.
Dr. Robinson also notes during the public health emergency, the annual renewal of Medicaid was suspended, but that process resumed May 1st. So if you currently have Medicaid coverage, keep an eye on your mailbox and be sure to submit for renewal to avoid any gaps in coverage.